Glossop Cricket Club has once again been turned into a mass vaccination centre, and 750 people will be having their jabs today. It means that 4,000 inoculations have been given since the service started a week before Christmas.
Amazing job.
Oh, everybody is. We couldn't have done it without each other. But it's been fantastic. Yeah.
Anything that you'd like me to sort of mention to ministers next time I'm talking to them about how things are going? Anything that could be better?
No, I think as a community, everyone's pulled together. It's been fantastic. It's been great. I think every bit of the patients and the healthcare team, everyone's really just come together, and that's why it's worked.
How fantastically Tameside and Glossop's doing.
Yeah, I think the key reason is that ICFT, CCG, PCNs, community, and more importantly the practices. Because unless the practices would have immediately signed up, we couldn't do it. It's their patients. So everybody's cohesively working, and the number of meetings we do ahead of everything is phenomenal.
They're the ones picking
As I said before, you should all be so proud and doing such an amazing job, and the whole community definitely is very, very gracious and very, very thankful for all the work that you're doing. So thank you so much.
This is our hub.
You get a double check on the 0.5 mil, just so like a safety check myself.
Your date of birth.
23rd of June.
That's great. Just to do that extra cohort at, more people. Because if we're getting 195 bios, that's 195 new patients.
Thank you so much.
Yeah.
Very much. It's brilliant. It really is.
Oh, I've no problem at all. I just want to have it done. I'm really, really pleased that they're doing it.
That's
excellent.
good.
I'll be doing your vaccination today. Just need to know your health.
In the next 12 weeks of when that is. Okay.
Yeah, brilliant.
All right.
Thanks
take care.
very much.
He will arrange an appointment in the next 12 weeks for you. All right. This is the information about the.
How many inoculations are you hoping to give today?
We're doing 750 vaccines today, and then we've got another 100 booked in for tomorrow, so over the 2 days, 800 vaccines. Half to 5,000.
And nearly 5,000 we have given in Glossop, but across Tameside and Glossop, we have crossed 28,000 vaccines.
And it must have taken quite a lot of administration work to get all this in place.
Yes, of course,
It has,
a lot.
yes. Lots
This
of
is the
work.
lady behind all the management.
But again, I couldn't have done any of it without the teamwork, the practices, the being around the doctors and the board. It's been a big team effort.
Yeah. And the centre is here at Glossop Cricket Club for how many more weeks?
We've got it till the first week in April, and then we need to discuss future if we can extend that.
What's the date of birth?
Had any vaccinations in the last 7 days?
They'll run through some questions to make sure you're safe to have the vaccine, and then they'll say.
I'm very impressed with what you've seen today.
Yeah, absolutely. It's great to be here today, lending a hand, volunteering in the car park, and it's just fantastic to be able to see the amazing work that the team are doing. As has been said, the practice managers, the nurses, the pharmacists, the doctors, the volunteers, everyone doing an amazing job. It's brilliant in my role, having Tameside and Glossop, which is one of the best CCGs in the country, leading the way, showing the rest of the country how it's done, and saving lives, and every jab is a step back to normal.
That's good news.
If it's going to do some good, it's fine, isn't it?
Well, that's the main thing.
Just get it done.
And it's all over in a few seconds, I think, as
I
well.
know they're passing the praise, but Vina and Sharon, I mean, stepping up to the plate of the extra work on top of her existing commitments, I think is really quite tremendous. And the programme wouldn't be where it is without your dedication and efforts. I absolutely agree with what people have said. It is about pulling together. We've had great help from the CCG. The tent and the safety areas, the IT, the equipment, all sourced from different places in Europe, has been fantastic, and we've refined it. But the efficiency that is behind the programme with Sharon, the dedication with Vina, that's what's making it happen. and happen as fast as it is.
We are all in it together.
Yeah.
That's the key thing.
Are you quite happy to be going in?
Yes, I can't see much reason not to.
I'm not frightened of needles?
No.
Oh, that's good. Thank you very much. Oh, I did go.
I'm fine.
You're in and out in a couple of minutes,
I know.
aren't
Yeah, great.
you? So when you're okay?
Yeah, fine, yeah.
You're in and out in a matter of minutes, aren't you?
Oh yeah,
Come on.
it's very quick, yeah.
There's no waiting at all?
No, I've got to sit in my car for 10 minutes now.
Yeah,
Before I
that's
drive
it.
off, yeah.
And of course the jab doesn't hurt, does it?
No?
How many spaces do we have?
out. And hold that one coming in.
Take care. You good?
Jeff Hall, one of the small army of volunteers here at Glossop Cricket Club. Can you tell me how you first got involved?
Yes, there was a message on Facebook from my particular surgery, which is Manor House, looking for volunteers, both medically trained as well as those that could help out doing marshalling and admin. So I put the name forward.
Here since what?
Well, the first week, the first week just before Christmas. And that was really quite challenging because of course it was a lot of very elderly individuals, so we were using quite a lot of wheelchairs to get them into the vaccination centre behind us, so yeah, that was quite challenging.
Thank you, David. Things have had an amazing start, like through the Christmas. We have nearly done all our categories 1 to 4, which were in the priority list. We are just trying to catch up with the remaining few that we are doing today and tomorrow, and again next week one more session, and then we would have completed our category 1 to 4, including our housebound patients, our care home patients, our extremely vulnerable patients, and obviously the other in the category health and social care staff.
And things have been running very well, have they?
Amazingly well, and it's all due to the support that we've got from our local practices, all our staff, our local ICFT, our CCG, our practices, and most importantly the local community. The volunteering that has come, through requests for volunteering, the retired doctors, they are wanting to refresh their training and come and help as volunteers, and community is wanting to help us in every possible way. Couldn't thank our community enough, and obviously our local practices, our clinical commissioning group, ICFT, enough.
That's good. So everyone's playing their part.
Absolutely. The spirit is amazing. I think people can see the light at the end of the tunnel, and they're all in it together to get there.
That's good.